Hello and welcome to another episode of Caring for Seniors. I'm Dave Stieglitz, your host with Oasis Senior Advisors, and today I'm excited to have Jasmine Hodgert. She's a dental hygienist, and it's a great topic that a lot of folks aren't totally aware of, the importance of oral health and how it can affect your entire body and your whole health system. So Jasmine, tell us a little bit about why you wanted to come on the show and the message that you have for our listeners.
Every day I have patients who honestly just have no idea how important it is to deal with their dental health. They don't have any idea that your diabetes can relate to it. It can cause diabetes. It is a contributing factor for diabetes and heart failure and stroke and heart attacks. There's just so much that is affected by your mouth. Just the inflammatory mediators from having periodontal disease. They can cause erectile dysfunction. It can cause respiratory issues. And I mean, there's tons of elders that are dying because of aspiration pneumonia, which is preventable. America, by the way, is out of all the wealthy countries, America is the number one for deaths that are preventable.
Really?
Yeah.
Really? I mean, I've heard before, anecdotally about, that your oral health and your mouth can affect, but this is very far reaching. This is very deep, and it's, even if, your teeth are gone and you got dentures or whatever like that, you still have to take care of your mouth. What is the minimum that people should be doing for their oral health?
I mean, every 8 hours is about when hard buildup happens. That's when you have to go somewhere and get it taken care of. For especially elders, you have a lot of plaque buildup, and it's hard to get the plaque out of your mouth because you don't have any saliva because of medications you're taking or illnesses that you might have. So just brushing your teeth is the bare minimum, and elders aren't getting that care oftentimes, or we assume that they're able to do those things and get that kind of care. But I mean, I have my hand that I just had surgery on, and brushing my teeth is hard. I have to ask for help to open the toothbrush. If you have issues or ailments or surgeries, it is incredibly hard to take care of yourself. And as you get older, you have a lot of issues with your hands and being able to take care of your mouth.
Sure.
So the bare minimum is brushing our teeth, maybe rinsing our mouth out several times a day. People don't realize that dentures have to come out and they have to get clean. Otherwise, you get stomatitis, aphthous ulcers. There's just so many thrush, so many complications that can come just from not taking care of your dentures, not taking them out of your mouth, not going to see a dentist to make sure that they still fit.
Exactly, because you can brush your teeth, but you still need to see a dentist once or twice a year, because I know when I brush my teeth twice a day regularly. I've got one of those electric things, but they're still scraping all that plaque and everything off my teeth. It still builds up.
Yeah.
So you still have to see a professional. What are some signs, real quick, that maybe a family member, maybe an adult child of a senior should be looking for to see if they maybe need to try to have some intervention with their mom or dad about their oral health?
That's a good question. So oftentimes some of the signs go unnoticed, but some of the signs can be that they're not eating as much. They have no desire to eat. Having thrush or a buildup of bacteria in your mouth coating your tongue can change the way things taste. The medications change the way things taste. And on top of that, they can have pain in their mouth. And so not wanting to eat or limiting how much they eat can often be one of the biggest, hey, something's going on. Maybe we should get them in for a dental visit. Maybe we should ask them, are you able to brush your teeth?
Yeah.
We have floss that fits around our fingers, and people think that's the floss. Or you have the ones, the little
things.
picks.
Yeah.
You think that's it. That's all we can use. But there's actually floss with handles. And for an elderly person, trying to use a small piece of floss is not ideal. So if you look at some of the options out there, you also have like the handles, and you can get back there and floss. And you can put tennis balls on the end of toothbrushes or on the end of those handles, and it gives you much more to grab onto.
Not just on the bottom of the walker.
Yes.
On the toothbrush. Well, this is awesome. Yeah, I really appreciate you sharing. This is an important, very important topic for our seniors in our community to know. If you want more information on this, you can always go to iwannabuzz.com to see this and copies of our other shows. And we wish you all a great day today. And remember, finding the right place means everything.